of the Kenya Medical Supplies Authority, Dr. Jonah Manjari, has denied the institution used billions of shillings meant to fund universal healthcare to procure COVID-19 goods from suppliers worth 7.6 billion shillings that is now lying as dead stock at the KEMSA stores. However, Manjari failed to produce documentary evidence to back his position when he appeared before the National Assembly Public Investments Committee. A special audit has revealed that KEMSA breached the Public Procurement and Disposal Act and used universal healthcare funds from its revolving account without authority from the National Treasury.
And on 5th of February, I remember a letter was written to us by the Director General, and we were told for the first time something that was done in reverse. We were told to prepare specifications for COVID items.
You see, facts can only be facts if they're substantiated.
My emails were removed, but I have access for the physical copies. I'll go physically and get them.
You shouldn't talk about things which you do not have documentary evidence to corroborate.
Is there any other communication that has advised you?
There was a communication of 1.1 billion assorted items.
Do you have that with you?
I don't have it, sir. The 1.1 billion communication was from the office of the PS.
Was it signed by her?
Yes, it was signed.
Okay. And do you have a copy of that?
Yes, it must be part of the copies that were presented earlier here.
They were not?
Yeah. During the State of the Nation address in April, KEMSA Act was said to be suspended for 3 months. And counties were given 5 billion to procure from the local market. Yes, and they are
By
there.
the time of the State of the Nation address,
yes,
you already had up to 5 billion in your stocks.
You had an amount of 13 billion financed by UHC, out of which only 8 billion had been received by 1st of March, by the time COVID happened.
we have not spent the 11.7 billion UHC fund.
Let's go back to how you buy and sell in your module, all right? And whether you are doing it from your revolving account, each time you are crediting it against what you have from UHC. Is that correct? Right, that's the point. Is it your explanation, therefore, that when you purchased goods for COVID during this period,
Yes.
you never at all credited the account of UHC? Is that correct?
We never credited an account of UHC.
Thank you very much. Did you show the UHC account to the auditors?
When they were auditing, I was not there.
And it says from the analysis, the burden of the liabilities came from procurement of PPE and other COVID-19 response items. These items were procured using UHC budget.
That this question that UHC funds were not used, which has been repeated to us here by your chairman of the board, and now you are saying, and was also repeated to us here by the principal secretary.
The PS.
No, the people who are saying that UHC funds were not used is a conspiracy theory by those 3 people.
UHC funds were never used.
Thank you.
Members of Parliament have shocked and irked Kenyans with their new demand that they